and addiction and mental health. Uh, we need to drive this conversation. It's very urgent. It's one of the most overlooked issue in our community. A lot of people really want to get into it, but mental health, addiction, and drug abuse in the Somali community in Minnesota is just getting out of hand. People are crying for help. People are confused. People don't know what is going on, and so you're here, and we're doing this to be part of that conversation. I know some people have started this conversation before us, and it's been an ongoing conversation, but you're here and we are just part of that circle that what do we do? And so welcome, Hassanen. I really appreciate you for taking your time this evening to come talk to us about this issue, because I know you're at the front. I know you are spearheading this issue a lot. And often I follow and I hear and I see what you're doing on the ground. So welcome, brother.
Thank you, Haji. Appreciate it. You have been my brother, and I don't need to tell you the work that we do. You have been in it. You have known us for over 20 years that you personally have known me, here in the Twin Cities. And I just want to say that, there's so much going on in our community in terms of mental health and substance use disorder. And there's not enough hands on the deck. We want everybody to know that what we're facing is not something that is light. When somebody loses their loved one, it's a big hit for them, and it's something we as a community have to be serious about it. And it starts with how we recognize it. We deal with things like shame in the community. We need to deal with things like feeling ostracized when you're suffering from mental health and substance use disorder. And this too goes hand in hand. And most of the people in our community, we feel from people who um, from the people who are involved in this, they know that they get to see a lot of issues going on in the community right now.
All right. And so we are, I just quickly want to add, Hassanen is the director of the Minnesota Somali Community Center. And they offer a lot of website. It's a nonprofit registered in the state of Minnesota. It's 501c3. And he's done amazing work. He's been doing amazing work. And so that is one important thing I wanted to add on. It's just not individually himself, but he's got really an organization that he leads that is at the forefront on fighting this issue of mental health, addiction, among many other things. You can go on their website. If whenever you guys have time, you can go on their website. It's Minnesota Somali Community Center. You can donate. There's a donation button there. You can definitely give $5, $10, $15. That's one Starbucks a day. They probably have 3 Starbucks. People have, I don't like Starbucks, by the way. I'm just, I don't know why I mentioned that. So my apologies. Nah, just go to Somali cafe or Somali restaurant or Somali sambusa, whatever you can get. Whatever you get, you can take some of that little bit of money and you can donate, and he can continue on this amazing work. Yeah. My first question to you, brother, is what are the most common mental health and addiction issues you're seeing in the Somali community here in the Twin Cities and also across Minnesota?
Yeah, so when you say that, I mean, there's many causes of mental health. There's many path of somebody who goes into substance use disorder. We usually work with folks in the 7 county metro counties here, Hennepin, Anoka, Carver, Ramsey, Scott. So all the 7 counties around here. We even got a request recently to come and help out with folks in Olmsted County and also St. Louis County, which is Duluth. They've asked us to come over there and do the outreach as well. But here's the thing that I want to tell the folks who are here tonight is that what we're facing something really big. We're losing people every day. And it's not only the youth. I personally have met somebody who's 60 something years that is on substance use disorder, and the family has asked me to intervene. I've known about mothers with kids that the kid's grandmother are filling out guardianships, and we do that in the organization. In case you want to know, the number you can call if you have your loved one, if you want us to help, is 612-440-1531. Again, it's 612-440-1531. You can call us and we'll be able to come talk to your loved one, find them if they're out in the street, have a conversation with them, see if we can direct them to any resources that we can have out there. Our address is 2400 Park Avenue, Suite 242. It's at the building that is called Center for Changing Lives on 24th and Park. What do? We give out knock-ons. We teach people about how to use the knock-on, And here's the thing. We have had instances of parents actually calling my personal cell phone and say, hey, my child is, unresponsive in the living room, and we've given them direction on how to do CPR and call 911 at the same time. So I tell parents that all the time, it's not shame for you to have a knock-on in the home if you have a child who's a user. Now, going back to your question about all those issues, our community comes from a place of trauma. The parents have gone through civil war, have gone through refugee camps, so on and so forth. Sometimes they carry those weight, and in some instances they have 19th century skills of dealing with issues, and now you're dealing with 21st century kids that needs a different kind of direction in how to deal with it. So I've seen kids, majority of them have been through abuse through their family members, societal, trying to fit in. I've met a group of like 5 girls, and I asked them what was the reason why you did it, and it was mostly to fit in. So the society itself, it changes the perspective of these young folks who need to feel like they need some belonging, and they go in. So there's many reasons out there, and it depends on individuals. But at the end of the day, they fall into the same trap, which they need to have acceptance. And sometimes it's very hard for parents. We come from families where if you do any kind of substance use, you're ostracized, you're seen like an outsider, you don't get help, you're being told like this is the path you choose for yourself, so you're out there. And believe me, tough love is good, but also when you're dealing with very severe mental health, and also when you're using substance, even if you use the harshest way of dealing with these individuals, they're not going to listen to you. So we need to find ways of bringing them back in, finding help for them, finding the resources for them, and we are here to help families do that.
So speaking of what you just raised right now, and I think this is a very important point, where we have individuals that in itself are not ready for treatment. They feel, for somehow, I don't know how they feel, but I wish we all knew, right? I wish we were all in the same place with them. I hope we were all sitting down with them and feel what they feel. We don't know. They best know how they feel. But what I wanted really to raise on that issue is the cultural and social stigma. And so you from your experience, and I'm speaking from, I'm saying this from experience because I've seen you many times. You've called me or you've posted on Facebook, or so many interactions you've had with the parents and the community, and so then comes the cultural attitude. How does that impact? Or how does that impact on how people talk about or seek help for mental health and addiction?
Stigma in the community is very, very big. I mean, there's a sense of shame. Like, for example, let me give you a good case scenario. Picked up a lady who was sleeping on the street, got the lady admitted at Fairview. It's down on Riverside and 22nd. While I'm with her at the emergency room, she's going through withdrawal and all that stuff. She threw up all over her clothes. And I had to call her parent, who lives in Cedar, like 3 blocks away. And the mother pretty much said, I am not going to be able to come over there to bring her clothes because I don't want people to come see me that I am actually helping out my daughter who is sleeping outside.
Wow.
So that's the fact, of what's going on. Our community feels a sense of stigma, a lot of shame. We have had a couple of deaths since January of this year for overdose, and most of the parents or families will not announce the funeral of that person, you know, and that's because of stigma and shame, and that has been going on for the last 5 6 years, that our folks have been dying out here.
Question everybody's asking. I'm sure every parent asks. I'm sure you hear that in the mosque. I'm sure you hear it in our community conversation whenever we are at the 24 mall or Khat mall or whatever mall we are in. We are asking the questions. What substances are being misused and what's contributing to their rise, especially among the youth?
Good question. When we were growing up, we saw people drinking alcohol and smoking weed. That was the most thing.
And Khat too,
And
Admiral.
cut, and
Yeah.
cut, and
And Khat has his own danger too, an addiction issue. But
absolutely, absolutely. When we were growing up, we thought it was a social norm for our folks to eat cut. Our
we used to
families
do it.
dealt
I
with it.
remember
It was a
I never
normal
used to,
thing, right? But
and
but
I never used to do it. I'm sorry.
science already mentioned, Khat
Yeah.
has caffeine within 24 hours, the same chemical as in cocaine. After 24 hours, it changes to amphetamine, which causes restlessness, mental health issues, so on and so forth. So that's a separate aspect on Khat. But here in America, some of these kids start with weed and alcohol, and then they tend to go and try something that is made famous, let's say in songs. There are many famous songs talking about, perp, a type of weed, or talk about popple, that you add on
Hip.
alcohol, you know.
I remember. I asked this question to one of
Yep.
those dinky
Yeah.
kids, and say
Yeah. And then,
hypnotized by music. Eh?
yes, you
People.
hypnotize. You remember that kid
Yes.
who'd say
Yeah.
that? Yeah.
Yes.
Yeah. You
Hypnotized by
listen.
music.
Yes. You
Addiction.
listen to,
Addiction through music, making it
yes.
more. Yeah. Yeah. I mean,
You
yeah.
listen to music. It glorifies pills. It glorifies snorting. It glorifies cocaine. You know, it
Weed.
glorifies weed. And by the way, weed for kids, for people who are younger than 18, when they use, has been known to cause a lot of mental health issues. And it's prone to bring depression. So weed can be good for some people. You know, and not beneficial for everybody. It works differently for other people as well. But here's the thing: 4 or 5 years ago, um, opioids came into the market. People are snorting, breaking down oxycontins, hydrocortisone. They are taking it through their noses. It used to be $35 a pill. You know, now you're dealing with fentanyl, which is 50 times more potent than heroin, very addictive, and you can get it two for $1. You can get it, very easily accessible in the community. But majority of the death is caused by fentanyl. When they smoke it, they don't even smoke a whole pill. They have to break it down. That's how more potent it is. And they young folks will sometimes be high or hallucinating, and they go and smoke a whole pill, and it kills them. You find, I've met with so many people that I've taken to treatment, that they know other people that have overdosed more than 4 times. I've taken people to treatment that have overdosed more than 7 times. you know they're pretty much like knocking on death's door every day. you know and then when they stop, now I've noticed another trend: when they stop using fentanyl, they go to using meth, which makes them move fast, like just be up 24/7. That's the thing that I've noticed nowadays. And then they still go back to fentanyl after that. So the brain sometimes needs to have some kind of redirection. And those are the things that mostly we see: weed, alcohol, fentanyl, and the fentanyl adding with meth.
So here is something else. I wanted to, maybe you might have an better understanding than I. But my wife and I were in discussion, and one of the conversation I had with my wife, She's also doing her PhD actually on mental health and addiction right now. She's working. She's going to reach out to you. She might be doing the last part of her research as well. But one of the things that I raised was, can shisha be laced with addictive drugs, and that leads to addiction? Because I've seen people that I know that use shisha and have moved on to other drugs. So I'm wondering if they, if maybe we need to do more testing on shisha and shisha spots and really see what's going on, because I see cases of people, very like community leaders, people that I have known, people that I've interacted with that have used or have been using things like shisha and have now graduated to a harder, a transition into a harder drug. So could this be something, maybe, since speaking from your own background and understanding what's going on? I don't know if you, I'm not saying you do, but
Yeah.
is that something that logically, if you're smart, that you can raise and say could be a reason, it could be a way also?
Yeah, so here is the thing, people tend to minimize. First, let me tell you this. Um, there is no aspect of people mixing shisha with drugs. Nothing like that. Those are just rumors that are going around. Even the mixture of weed with hardcore drugs, those are things that go down. Now, you know, you have to know some things, some you know, like weed. Weed is known as habit forming, you know, while anything with tobacco is known as addiction, you know. So tobacco plays with that place in your brain that actually makes you feel for it, and weed makes you form a habit that, hey, if I smoke this in the morning, my brain will be happy and I'll be able to do ABCD, you know. Okay, so getaway drugs, if you look at it, if you talk in terms of like weed and shisha, it can be in a form. Now here's a scenario I'll tell you. When people used to smoke and then shisha came in the market, people used to say, oh, it's only shisha, it gets filtered by water, there's nothing in there. But science doesn't lie. Shisha, smoking that one bottle of shisha for like an hour is equivalent to like smoking, I think, a whole pack or 2 packs of cigarette, you know? So you get more than just nicotine. You get nicotine, you get soot, you get smoke, you get carbon monoxide, you get everything that you're inhaling, that is not good. All right, if you go to vaping, I've seen a lot of people who say, vape will make you stop smoking. But when you look at it, vape has been known to cause something called popcorn lung. So your lungs are supposed to be moist, supposed to take in oxygen, and now your lungs are becoming hard as a wood, and it's not moist anymore because of the vaping. And then in vaping nowadays, there is that cartridges that are for synthetic THC, which has been known to cause psychosis. If you remember, when people used to smoke K2 before, they will get hallucination, they will fall down. So K2 is a synthetic, THC. It's the same as vape. So I've had young people who have been smoking vape, and then their friends are like, "Hey, try this bottle. It's a THC." And when they smoke it, they get psychosis. I swear to God, 2 weeks they don't know what they did. Literally, the 2 weeks they have been admitted in the hospital, tied down. They nearly met a judge who was about to confine them for like 6 months for mental health. And then after taking like, some mental health medications and stuff, now they're realizing, they're coming back to reality. They're like, what the heck? I smoked this like, half a month ago. I didn't know it was this bad. Now, in terms of getaway drugs, individuals are wired differently, like I said, and sometimes it can be genetics. There are people who can quit any kind of an addiction right away. They can say, you know what, I don't want to smoke, I'm done. I don't want to drink, I'm done. Cold turkey, and they're good. And there's some people who start today and they become the worst addicts ever. Now that has something to do with the genetics, has something to do with the parents' genetics, that they're very highly capable of being addicts. So you need to avoid things that entertain addiction. So
Moving
those
on.
are
Those are
the
those are
things.
things. I thought maybe shisha. Some people are not, really
No,
have the best of
that's
intentions,
nothing. There
and
was
and and
conversation. People
yeah.
there was conversation. People saying, "Oh, people. Some people add vodka in the water for shisha." No, alcohol doesn't. You don't smoke alcohol. You have to drink it.
All right. And
you know.
so the other the you raised something at the beginning. You talked about immigrants, especially African immigrants coming to the Twin City. It's not just Somalis, but many of us,
Yeah.
and we are, I think, facing the same challenges. Addiction. I think it's within our most of our communities. So it's not something only specific to Somali communities.
Yeah.
What unique challenges are Somali youth facing around mental health and substance use? So
Yeah.
if we can make it brief and we'll appreciate that. Go ahead. Hello, Sanin?
I have my little prince here who.
That's okay. That's okay.
Good night.
That's okay. Give her a hug. Okay.
Okay.
I got the little one that come down too sometimes.
Yeah. Repeat your question.
My question is, what unique challenges are Somali youth facing around mental health and substance use? This is coming from the beginning when you spoke about immigrants and immigration to America, and that question is explore that on identity-based stress.
Yeah. I mean, one of the best things about being a Somali is, your culture is something that is major, the center of how you live your life, you know? And most of the young people, they still feeling like there's a push and pull on terms of like culture and what culture requires for them, either being the males or the females. They still feel some type of it. And this has been an issue with all immigrants group coming to a foreign land, you know, where the majority culture is trying to influence the minority culture. So right now our culture is minority because we have majority around us. Our kids watch hip hop, they watch people wearing chains, they watch tattoos, they watch, earrings for boys, those things, and they want to fit in. If you go to a group of young kids who are together, you will find out that they tend to want to do the same thing together, and that's very normal. Now, the issue about addiction caused by not being able to fit in and all these other issues is not only pertaining to the Somali community in the Twin Cities. No, if you go to St. Paul, you can see a whole homeless shelter done by the Hmong folks. If you go to other places, you'll see other immigrants group. If you come to Brooklyn Park, you'll see, the West African group is suffering from mental health and substance use disorder, you know and East African communities apart from Somalia, they also do that. If you talk to the Kenyan community, they have a lot of suicides caused by mental health and substance use disorder, especially alcoholism. you know the fitting in, the new land, the culture clash, the feeling of belonging, all of that counts towards their feeling of how they feel left out. They don't know if they're doing the right thing in the Somali. People laugh at them when they speak Somali. They don't know, you know, if they want to fit with the American culture, because when they go there, they're told, you're not American, you're an
And
immigrant. You know?
speaking of that, if you let
Yeah.
me, speaking of that now, what role can religious leaders, elders, and parents play in helping break the silence?
um, our religious leaders have been very vocal about it. Matter of fact, I know some religious leaders or people who work in the mosque that their own children have died from addiction. Their own children, they're there. The thing is we talk about it only a little piece than how we should be talking about it. We should completely talk about this, because I can tell you this. One time I was asked, why are we not getting shootings in Minneapolis like we did before? And I told them most of the shooters are now dead. you know and the reason is we have to be realistic. We have lost so many youth to drugs that some of them are just seeing therapists just because they're friends with them. you know and it takes a toll when there's always a gap. For example, our kids nowadays, they create basketball tournaments just to commemorate one of them who has either been killed or died from overdose or something. And they do that as a way of honoring the family, like this is our friend. So it takes a toll. It's something that is very heavy. I think the religious leaders have to do a better work of coming back over and over again and talking about this. Now, do I feel there's a gap there? Absolutely. With every other society out there, there is a gap. Can we
Speaking of
can Yeah.
speaking of Gabs, again, I am the question that I want to ask now, talking about Gabs and this, and let's talk about resources. What resources exist right now? Are they accessible? Are they culturally relevant? And can they be trusted?
Yeah, so there is resources out there, and we try. Here is the thing, it's not enough, you know. It's not enough. What we have is we have like this. Like, for example, I can, you've seen, like, even on my conversation, I can go out one night and meet with a group of 7 8 individuals actively using in a bus stop that are Somalis, and I can have conversation with them, and they can say true that they have never met anybody who has been sober that has come just to sit down with them, give them like hygiene pack or food or anything. They have never met anybody, you know, and they have been in the streets for like 3 4 5 years, you know, on and off. If they're not in jail, they're on the street because their family cannot take them. If they stay at their homes, I know a guy who was brought back home and he left with a flat screen TV from the wall, you know. So families know that they cannot keep this person. I mean, like I say, they smoke. If they're using fentanyl, they want to use it every 2 hours. Signs is you'll find that person stuck in the bathroom. They don't want to get out. The room is all messed up. You'll find foil papers. You'll find white stuff all over the place. So do we have enough resources? Absolutely not. I had two programs. One of them is still currently working on the 7 counties. Now you can just imagine how crazy we are, and there's only two of us doing this work. And then there's another program which was from Minneapolis that ended and never got renewed. So if you look at it, there's other organizations that have been given funding by Hennepin County and I believe the state as well, but it's very limited that you see boots on the ground doing the work. That is like talking to parents, talking to individuals, going to drug houses. I've taken people to drug houses to get kids back home, and it's a serious business. I don't expect everybody to go out there because it's sometimes people say like, hey, how do you go to those places? And I said, hey, I'm just going to have a candid conversation with the person, to get them out. And in some instance where, like, there was a time I was told, hey, go pick up this girl who was at a camp on Franklin Avenue behind the three towers. And I met with the girl on Franklin walking with the boyfriend. And I said, hey, your parents, your family wants you back home. And she said, no, I want to be out here. She's 22 years old, and the family said, no, go to the camp and go get her. I said, no, I'm not going to go get her. She's 22 years. You cannot just go and kidnap somebody from a camp. Figure out a way where we're going to talk, isolate that person from the street, try to have that conversation with the person. We have limitation.
Yeah, we do have limitation, especially if somebody's 22 years old. It's very challenging, and that is akin to, really getting close to really doing something illegal, which is, and I'm glad that, you made that clear, because, and it's the intention is not coming from a place they want to put you in trouble. It's just they don't understand. Also, there is a complication of not understanding the law,
yeah.
understanding what age of consent is, what is allowable, and to some extent even treatment. Someone is free, they choose if they want to be treated, if they want to seek help. It's at the end of the day, somebody, like I said, has to be ready to do this. And go ahead, but you're saying something very important.
I'm saying one of the things that we do of our office is we fill out guardianship. If you find that your loved one is detached from reality and they're out there and they're not accepting treatment, we can go and go to the judge and get a guardianship assigned to you, and you can force those people to go to treatment. Now, would it work? Maybe it's a tool that you can use to force that person. Because I'll tell you this: there's a higher percentage of people that do not want to go to treatment because of how deep they are into mental health and substance use disorder. So we have to break that circle. One of the biggest gap that we have in our community is inpatient treatment for our girls. We don't have it. I know of 3 places that opened and closed immediately before they even hit like 1 year, you know, because the population of our girls who are using very, very tough than the boys. You know, I have my own theory. My own theory is this: is that boys tend to start using drugs easily and they can quit easily. Girls tend to start drugs after so much like being pushed, being peer pressured. Finally, they go in, but they find it very hard to quit. Very hard. So
What is that? Which of the two is the larger number? Is it the boys are more in addiction, or is it the girls, or is it the girls less? Since you
oh,
got into this,
I don't wanna scare the community, but we have tons of people who are in substance use disorder. Tons of people. I can say that whenever I have conversation with
is it 5
girls.
out of 1, 6 out of 2, 3 out of
Man,
what?
I
One
had a
out, 6 out.
conversation. I had a conversation with a girl, and I'm taking her to treatment, and she says, "Apti, if I tell you the truth, when I come back, I would not have one friend." And I say, "Among your circle, how many use and how many are clean?" And she said, "Only one is known to be clean. The rest are users. They just don't tell their parents."
Where is the point of entry in these drugs? Where is the point? Okay, is it mental health that leads to it? Is it stress? I mean, how what is the point of entry? Because I think that's what parents ask a lot. Those are the questions they
every
want. Like,
every everybody is different, like I say. But one thing that I found it's common is this: is that they either started smoking weed. There's nobody who jumps straight to meth or fentanyl.
it's got to
they
start
were,
somewhere.
they were smoking weed and they were drinking alcohol. So it was all easy for somebody who is high or who is drunk to say, "Hey, do you want to try something new today? Yeah, let's pop some pills." You know?
Peer
So it
pressure.
was, yeah, it's
Peer
very
pressure.
easy when you don't have your senses,
I,
your
I, I'm guilty. I'll be honest with you. I mean, I have never indulged in any of these drugs, but a cigarette, when I was in high school, I got introduced smoking cigarette by close friends, and alhamdulillah, I quit, I quit. But, friends can have a huge influence on our children. They
very,
do. And
people
I
say,
mean,
show me your,
and
show me
what
your
should
friends.
and what should yes, and what should parents watch their kids who they're befriending, who they go
Oh,
out with?
absolutely.
Should
It's
they
it's
like be on point? Like,
yes.
should they stalk them and
Listen,
just be like, hey, where are you going? What time is it now? And I
listen.
mean,
I,
yes,
I'm a parent. You're a parent. I'll tell you this. We went through parents and stuff. I think you are the last born in your family. I'm second youngest in my family, right? And we
yes,
had very strict parents. In terms of like curfews, knowing who are your friends. You gotta know, man. It's the science of human nature. Show me your friends. I'll tell you who you are. You know, it's a science of nature. You know how it is.
we're
Show
lucky.
me your
We
friends,
were
and
yeah.
I'll tell you who
And
you are.
you're from
So
Mombasa. I'm from Garissa. We were raised by everybody in our community. Everybody was watching us and saying,
yeah,
"Hey, one day I remember when I was young, I rolled up, I rolled up a paper. It didn't have anything in it, just a paper I rolled up,
yeah.
and I pretended that I was smoking cigarette. And then actually a neighbor saw me and went to my dad and said, "I saw your son pretending to be smoking something. When
Okay,
I
yeah.
got home, I got whooped. You know what I mean? Like I
You're
it
you're
was like."
lucky if you didn't get whooped by the neighbor first
Exactly.
before you.
He did not. He did not. He did not. So that is, those that we might be laughing now about it, but it's a serious thing. I mean, like, and it's just unfortunate that we don't have a community. And
Hey,
speaking,
here is the thing. Like I said, we grew up in a different time. I can tell you this. My brother, he is over 60s now. He still, uses and stuff. You know, he's not dead. He's still alive. He's in Somalia. And if there's anyone that would have quit because of being whooped and being beaten up, he would have been a pope right now. He would have been the saint of Somalia right now. You know what I mean? The amount of whooping he got for drinking and smoking weed, you know? So I tell people, listen, 19th century parenting does not work with this 21st century problems.
Right.
You know? And the other thing is I'm gonna be real. We have very much resources here. I know two-parent household here who have felt defeated because they cannot seem to be able to help their kids, right?
Is it because they can't find time because of work?
No, because you know the laws themselves sometimes ties your hand.
Oh, that's
You
true.
know, I have a parent who is very rich. One day, she came to my office and she said, "Listen, I'll pay $18,000 for my daughter to go to treatment. This is a private treatment. $18,000 a month. I'll pay for it if she accepts it." She still says no. She sleeps on Lake Street. You know, up to today, she says no. I don't want to. Went to court to get guardianship, right? And at the guardianship, the girl showed up and said, "No, I have my own senses. I can make my own decision." Even when she had like history of mental health issues, and the judge allowed her to go away with no guardianship. You know, so the fault is not parents that don't have resources. We have insurance that covers your mental health. We have insurance that will take you, you know, to treatment and pay for it. We'll give you food, clothing, shelter. We can find you resources. We can find you schools that you can go in. We can go to court and get your expungements and get you back in hall and be able to find a job and be able to live alone. We can even find you resources for you to live alone. If you feel like your home is toxic and you want to be independent, we can get you homes and you can be there, sober houses or transitional home or your own separate apartment through GRH or whatever, you know, that you can be in. But if that person does not want to have any kind of assistance, the only way is maybe law or court or whatever to push them to take that chance, because your chance, you as a parent, your hands are tied, period.
Thank you so much, Hassanen Mohamed from Minnesota Somali Community Center, for joining us today and talking about Minnesota youth and mental health and addiction. Great conversation we've had. For those who are joining us, I will repost this whole interview on YouTube. Hopefully you can go and have access to it there. It's a great conversation to have. It gives you a lot of insight from someone that has really been in the community working on these issues for many, many years. So we're talking about personal experience and we talk about interactive experience, both with the parents and young people who are facing addiction in the Somali community. So I want to say thank you to Hassanen. So you, the audience, you who are listening, to all of you, I would have loved for you guys to have shared this so it can get out to most of our community here in Minnesota. People, it can reach more people, especially parents. They can use some of these points that my brother Hassanen has raised on this issue of mental health addiction in our community. So just don't watch, share. It's
What?
it's sharing is caring. Sharing is,
Yeah,
I'm not asking so you share because it's my podcast. I'm saying share because I'm sharing. I'm here talking about it. I have invited Hassanen to come on this show to talk about this important thing. If it was something else that I was gossipy about, two people fighting, millions will share. But share so it can get to people that we need. So now it's on you. You now, listeners, thank you for joining us. By the way, and being patient and following all this through us with us. Whether you are parents, whether you're young people or community leaders, we need to start making change and we need to start having those tough conversations. And one person you can always count on that to be part of that bigger conversation is Hassanen Mohamed from Minnesota Somali Community. Go out to the website, please, and make a donation. If you need to know more, please share me. I will share his information and his website with you. The other thing I want to tell you is we have a great event coming up in June 28th. We have the Great Sambusa Festival and more so with Sambusa contest. So watch out the website and sign up. Everything is coming and we're going to have an amazing event. Thank you so much, Minnesota Somali Community Center.
Yeah,
Hassanen.
one more announcement I want to make is that we have had a group of mothers who are frustrated about their kids going to treatment over and over again and not being able to kick this addiction. They are putting together a community event that will be coming out in the future. So stay tuned. We'll be announcing that conversation because what they want to know is what can they do to make sure that the treatments are very effective for their children so that they can beat this disease that is ravishing our community and killing so many people for years now.
Thank you so much, AH, for sending Minnesota Somali Community a rose. I really appreciate that. Thank you, guys. Thank you so much for joining us. It was an amazing conversation. I hope we continue having this conversation. Hassanen is going to be back again, and we will continue. But this is on you now. If you're in Minnesota and watching this show, the ball is in your court. You got to do what you got to do to help save our youth from the issue of addiction that is ravaging our community right now. And it's you and I together in this. Thank you so much, Hassanen.
All right.
I will
Thank
see
you.
you guys, and hopefully we can talk again some other time. Take care. Good night. Be safe, and hopefully I will have that conversation. Thank you so much.
All right. Bye.